Hi guys, today we're going to talk about snake bite piercings. I tried to answer every single question that I could find, even in my past videos, so I'm sorry if I didn't get you, but I do hope that this helps you. Let's get started. Can I get invisible jewelry when you first get pierced to wear to work? The answer to that is no. The clear jewelry is made out of rubber or something like that, and it is not as strong as what the piercing is made out of, whatever kind of metal that it is made out of. Depending on where you buy it, it's made from something different. Even after you've already gone through the healing process, the invisible jewelry isn't as strong, so the piercers advise that you only wear that type of jewelry for up to 8 hours. Although I have worn that jewelry for longer than 8 hours, I don't really see it being a problem for longer than that, but you do want to make sure that your piercing is fully healed before you use any sort of retainer. So you can't use clear jewelry going through the healing process because it's not that strong. Can you treat it with Vaseline or will it mess it up? I have heard of people treating their piercings with Vaseline, and I think that it's fine, although I have heard that it's really clumpy. I personally haven't used it. It apparently helps to reduce the scabbing around your piercing area, but what I would advise to use for moisture, if that's what you're concerned about, I would use vitamin E oil, which you could find at any corner store. It should say just vitamin E oil on it. That's what I used for my gauges whenever they were healing, and it works the same to moisturize your lip piercing. So if you want a moisturizer, I would suggest vitamin E oil before using Vaseline. Can you just wear the bars if you're getting them done? No. And if you're asking if you can take the ball off and wear the bar like that, I really wouldn't suggest doing that. I used to have my Monroe pierced, and I would try to hide it during the healing process, and the way that I tried to hide it was by taking the ball out and just wearing the bar, and it was very annoying. It comes out a lot and it causes more irritation because this part, since it was barely during its healing process, this part was like, would get like a seal over it sort of by the end of the day. So when I would push it out to put the ball back on, it would get really, really sore because it's like reopening a wound, reopening a wound. That's like, it's like having a cut on your hand and then you just like poke at it with a toothpick all day or something. It's pretty much what it's like to wear your piercing like that right away. So I really wouldn't suggest doing that if you're trying to hide your piercing. Can you use pain medication? Definitely. I honestly don't think that it's necessary, especially on the first day going in there. You think it would hurt a lot more than it actually does. The way that I pictured it getting snake bites done, I imagined like, oh my gosh, whenever I bite my lip, it hurts really bad. But when you bite your lip, it's your whole tooth biting your lip. It's not a tiny little needle going in to your lip. So really, it's really fast and you don't feel it at all. What really hurts is the swelling and the healing process. So if you're worried about pain beforehand, sure, take some ibuprofen, some Tylenol. I'm sure it would help you a little bit. But I would advise to use that stuff, especially afterwards during the healing process. With the swelling also, ibuprofen does help with the swelling a lot. Did I ever bump them or snag them onto anything? Mainly whenever I was getting undressed and redressed, they would get caught in my shirt sometimes and stuff like that, and it's really painful, so just be really careful. I mean, just like lift your shirt up over it or something, and I mean, my sheets are like this, so they didn't really get caught on to my piercing or anything like that. So, I mean, aside from just my shirts, nothing really snagged onto them. Just be careful because it is painful when you do that and they're fresh. Is there anything you should ask the tattoo shop about spacing? That's your own personal preference. Depending on where you go, they may have a completely different routine of how they go through it. The way that my piercer did it, I mean, I went in, he had a little pen, he said, okay, do you want them close, normal, or wide? And I said, I guess just normal. He put the dots on there, checked them out in the mirror. I liked how they looked right then and there, and I got them like that. Personally, I like the normal ones. I have seen people get wide, and again, it depends on the shop that you go to, what they determine is like close or regular or wide. I don't know if there's an exact measurement. I doubt it. I think that it really depends on each shop. So the shop that I went to wide was literally almost all the way at the creases of your lips like this. And I didn't want them so wide like that. And then closer, I didn't really want them that close together either. So really, it's personal preference, and depending on what shop you go to, if it's something that you want to ask about and they don't give you more than one option, then definitely let them know that you want them a certain way. Tips on making them less noticeable in the workplace. Honestly, I didn't ever really have to hide my piercings in the workplace. But I have had to go to casting calls and things like that where I do have to hide my piercings. Now, I do use the stud retainers, but what I would also suggest to people is to get the clear hoops. I honestly think those are a little less noticeable. I mean, they're both equally noticeable. They're not completely invisible, at least not the ones that I have. They look clear, but when you have them on, it looks like a little black head or something. So I'm not a fan of wearing the stud ones. And my sister used to have she has one lip piercing, and she used to have a clear hoop. And I think that that's easier to look past than the clear studs. So I would advise going for the clear hoops. Okay, why is your lip still bleeding and why is the inside of it purple? If there's discoloration, pain, excessive redness around the piercing, if your bleeding is prolonged, say more than 4 days after the piercing, if there's any sort of discharge, um, if it's hot at all, the area is hot at all, then you definitely have an infection. Now, if you go to the doctor, or some doctors might tell you to take the piercing out, but don't. Definitely do not. If your piercing is infected or you believe that it would be infected, your best bet is to treat the infection, not to take the piercing out. If you take your jewelry out, then it's going to close up the infected area, but the infection can still stay inside. If it's infected, this is acting like a drain to drain out all of the nasty bacteria. If you close it up, there's nowhere for the infection to go, and it could result in an abscess underneath your skin. So that's really gross, and I'm sure you don't want that to happen. So if you do feel that you could have an infection, treat it with hot water and sea salt. Just get salt water. Use sea salt. Don't use regular salt. You should not use regular salt. You need to get sea salt and water. Mix a little bit of that in there. Maybe swish it around a little bit. And also get some on some like cotton swabs or cotton swabs. Some cotton swabs or paper towels, and dab that around the outside and just clean it really well. And then you might want to get like a hot rag with sea salt and just like hold it over, because heat and dampness will help with the infection to go away. So if it gets really bad, you may want to even ask your doctor for an antibiotic for an infection. If it doesn't get any better with the sea salt, then definitely see your doctor. And try to avoid smoking, especially if you think you have an infection, because it can make it worse. Just saying. How many weeks before you can change your piercing? Like I said earlier, you want it to heal completely before you can change a piercing, and that's going to be anywhere from 6 to 8 weeks. And again, it depends on the person. If 6 weeks pass, you might not be healed all the way. Maybe some people heal in 4 weeks. It really depends per person, but I would advise waiting at least 6 weeks before you change your jewelry, because I changed my jewelry at 4 weeks and it was disgusting. I felt like my piercings were healed, I wasn't swollen anymore, there was no real sign of irritation. I thought it was fine, but they were still tender. And so when I took them out and I tried to put another piercing in, it was just a mess. So I would really advise waiting at least 6 weeks. Don't try to rush it. Really be patient with it. If you feel like your healing is completely done already and you can switch them out, I would at least wait until 6 weeks just to be sure, because you really don't want to have to go through that whole swollen, nasty, gunky. You don't want to go through that again. My swelling went down after about a week and a half. Actually, the first day it didn't really swell at all. It didn't get swollen until the second day, and then it progressively got worse. So probably the first week was the worst. The first 3 days after I got the piercing done were the worst. And then slowly but surely the swelling did start to go down. Like I said, using ice and ibuprofen is really good. How old was I when I got my lip pierced? I was 18 when I got my lip pierced. I've had them for about a year now, and honestly, I don't really clean them that often. I do clean them anytime I change them out, obviously. I do mouth rinse every day when I brush my teeth. And occasionally I'll use the Bactine, but I've had absolutely no problems whatsoever. Whenever I'm changing the jewelry, sometimes, especially whenever I put the bars in, they do still irritate the back of my lip a little bit, and that's why I do prefer the hoops. But besides that small irritation, like it goes away within a few hours, really. Besides that, it sort of all goes away. Like, you don't have to maintain your piercings for years and years to come. Did the backs of the piercings ever stop digging into the back of my lip? Yes, they did. Thank goodness. After a while, it will heal over, and it shouldn't really leave any sort of marking on the back of your lip anymore or really bother you at all. Do I feel the bar in my mouth, or is it something I don't really think about? I don't know. I obviously can feel them, but it's not so much like, oh my gosh, there's a bar in my mouth all the time. Like, I know that they're there, obviously, and I have a really bad habit of playing with my piercings when I'm bored, but is it bothersome? Not whatsoever. They just become a part of your face eventually. You don't really notice it anymore, so yeah, I got used to it. Do snake bites make your teeth crooked? I don't think so. Not that I'm aware of, at least. I have heard of snakebite piercings causing some of the tooth to chip off and stuff like that. I've never actually known anyone for that to happen to, but I've heard it. I've heard that it happens, but I don't know. It hasn't happened to me, so. The cleaning routine that I have on my other snakebite video, how to clean snakebite piercings, yes, when you first get your snake bites done, you should do that every single day. You don't want to over clean because then you might irritate and over dry your skin. I would definitely clean it twice a day if you can, in the morning and at night, and even try to rinse out anything around that area after you eat. Don't just leave that bacteria there. So every time after you eat, when you first have your piercing, since it is in your mouth, try to rinse everything out, okay? Or I would advise for at least 4 weeks continuously, at least 4 weeks, because you want to make sure you have everything completely clean and sanitary. When I first got them done, how was I able to eat? So pretty much they gave me a paper that said you cannot eat this stuff, right? Pretty much no spicy foods, no salty foods, no dark drinks, no smoking, no drinking out of straws, no alcohol, things like that for the first few days at least. Because especially drinking out of straws and smoking, whenever you're sucking in, it can cause your piercings to bleed more. So you definitely want to avoid drinking out of straws or anything like that. And I tried eating stuff that was easy to eat that I didn't really have to chew on, because when you're chewing, it causes aggravation to not only the piercing but to your gums also. Because when your piercings are fresh, your mouth is obviously not used to having those pieces of metal there, and when you talk or eat, it's gonna do this and just thus rub up and down while you're eating, chewing, and then they're going to get stuck on your teeth sometimes, and it's really frustrating and can be really painful during the first few days. So I would advise things like soup, ice cream, yogurt, pudding, anything that's easy like that that you don't really have to chew a whole lot during the first few days. I actually think I tried to eat a hamburger the first day, and don't do that. What kind of toothpaste should you use? I don't I don't think it matters. That's just me. I don't think it matters. Now, when you have your lip piercing for a long time, will it still close up when you take it out? I had a friend that I used to work with who had snake bites, and they would take their piercings out for the entire day, and they wouldn't close, like up to 24 hours. I'm honestly not that comfortable with taking my piercings out and leaving them out. The thing is, if you take your piercings out and they close, you can't pierce them back in that same area because there's going to be scar tissue there now, and you're going to have to get them pierced somewhere either a little further out or a little further in. I honestly love my piercings exactly where they are, so I've never had my piercings out for more than a few minutes. And I've already had them for about a year now. I'm sure that they would be fine for up to a few hours, I would say. And like I said, my friend used to take them out for up to 24 hours at a time. And so I think it really depends on who you are, how long you've had them, how comfortable you are with having them out. That's really it. Will my lip heal with the retainer? The answer to that is no. Like I said, the retainer should only be worn for up to 8 hours. It's not really safe, especially whenever you have new, fresh tissue that's open to be around that material the retainers are made out of. So definitely want to wear the metal. How would you hide your snakebite piercing the first day? I honestly don't think there's a real surefire way to hide your piercings right away. I don't think that there's a safe way to go about it or a sanitary way to go about it. Like I said before, my Monroe piercing before, I would try to hide it by taking the ball out, and it just caused more and more irritation, probably left a worse scar because of it, and it really just wasn't worth it. So if you're in any circumstance where you're going to have to hide your snakebite piercings like the very first day that you get them, I would advise waiting, just because I don't really think it's a good idea, and I think you should definitely wait for your snake bites to heal completely before you try putting in any sort of retainer or anything that would hide your piercing. That's pretty much it. Those are all the questions that I had. I appreciate you all watching and asking those questions. And feel free to leave me a message, comments, anything if you have any more questions or anything you'd like to tell me. That's totally cool. And don't hesitate to leave your video responses down below, okay, you guys? I will see you guys soon.